pre-purchase exam survival tip. There are many aspects of veterinary medicine that are pretty wildly subjective, and one of these areas are flexion tests. Flexion tests are usually part of a pre-purchase exam. The point is to stress a joint to show if there are any underlying, changes going on in the joint or problems with the joint, like arthritis that's gone undetected so far, OCD lesions, that kind of thing. So to flex a joint, a vet will do one of two things. Sometimes they'll either just flex the whole leg, and then if the horse trots away from the flexion test sound, then they'll move on to the next leg. And at that point, if the horse is lame, then they'll go back and go joint by joint up the whole leg. Most vets nowadays just start off by doing each joint within the leg. Now, here comes the subjective part. Some vets will only flex a joint for 30 seconds. And then they put the foot down and the horse is supposed to be trotted away. Some vets will flex for 90 seconds. Also, some vets crunch those joints a lot harder than other vets. So that's another factor that can determine how the horse appears after the flexion test. Some will have you trot down to the end of the ring or the driver or whatever and then turn around and trot back. Some just want you to go straight away. And then the other subjective aspect of this is that they're supposed to grade the lameness on a scale of 0 to 5. Some vets use a scale of 0 to 3, with 0 being no lameness present after the flexion, and 5 being like, they can't put their foot on the ground. Well, that's pretty subjective. Some vets have called, a horse a 3 when I would have called them a 1, sometimes vice versa. And I've even heard of a vet who was doing a pre-purchase exam turn to the seller, who was a professional, and say, I thought that flexion test was kind of iffy. What do you think? And she thought, what do you think I think? It's my horse. I'm trying to sell it. I thought it was fine. Another thing that can affect the outcome of flexion tests is the horse on Adequan, Legends, oral joint support. Is the horse getting injections in any of these joints? Another problem of flexion test is that it's pretty hard to effectively flex the stifle and near impossible to effectively flex the hip. Plus, it's hard to isolate the hock, the stifle, and the hip when they're flexing that, corner of the horse. So, it certainly is possible for a horse to have no findings on the flexions, to trot away from all the flexion tests perfectly sound. If that happens, that's great. If a horse does show some lameness after a flexion test, a lot of times then it's recommended that you radiograph and see what is going on in that joint. Or you can just stop the pre-purchase there if you wanted to have a horse that was perfectly sound. So the problem is, or the potential challenge, I guess I should say, to be more positive, is that if the buyer and the seller and the vet, or any combination thereof, interpret these findings differently, it can lead to, hurt feelings, arguments about, how lame is lame, how lame is too lame. But I guess my point was mostly to educate. Some people don't really know what flexion tests. Oh, and then another thing I hear about more and more is, especially for like performance / riding type of horses, a lot of times now the vet wants to see the horses ridden during the flexion tests. So you need to be prepared for that. It can be kind of awkward to ride a horse through flexion tests, but I see why they want to do it. If the point is to see how sound the horse is under saddle, then I get why you would want to do the flexion tests under saddle. But it's taken a few people by surprise. Another thing that a flexion test can illuminate, that's kind of a bonus tip, is it can give you some insight into a horse's personality that you might have otherwise missed. Because even, I think, if the horse is sound, it can't be comfortable to stand there with your leg all crunched up. And there's a lot of joints in a horse's leg, so this can take forever. So if your horse gets grumpy, or sullen about it, or, makes a little cow kick at the vet, or a lot of young horses when you trot them away, because you're supposed to trot them off like pretty vigorously, and so sometimes there can be quite a circus when they go leaping off after you put their foot back on the floor. So you can learn a little bit more about the horse's proclivities during flexion tests also, which is kind of nice. Anyways, as always, don't panic if there are some minor findings in the flexion tests. A lot of times I think it is a good idea to x-ray, because otherwise you'll just, worry and wonder for the rest of that horse's life. what is in that joint that you don't know about. But don't panic. A little soreness on a flexion test is pretty normal. Certainly not the end of the world.